For my project, I did Nourishing the Brain and Prevention of Alzheimer's, and my research question was how do Mediterranean-based diets alter the health of the brain? Alzheimer's disease is a degenerative nerve disease in the brain. Its greatest known risk factor is increasing age. 65 and older is the common age of diagnosis. It worsens over time and it can put a strain on family and caregivers as people with it tend to lose sense of independence, identity, and obviously their memory. It has no cure, but lifestyle choices can lower the risk. I wanted to learn how nutrition could delay or prevent this disease, so that's why this matters. And a lot of people are affected by this disease and it has no cure. So the Mediterranean diet is at every meal you have fruits, vegetables, whole grains, and extra virgin olive oil, and at least 3 servings per week of fish, nuts, and legumes. And you limit to 1 serving per day poultry, low-fat dairy, and eggs, and limit to 1 serving per week is red meats and sweets. The DASH and MIND diets are diets that are linked with the Mediterranean diet. So DASH is the dietary approach to stop hypertension. It's more for high blood pressure rather than dementia or the brain. It treats high blood pressure. It emphasizes fruits, vegetables, low-fat milk, fish, poultry, beans, and nuts. It limits sodium, added sugars, and red meat. So it's similar to the Mediterranean diet. And in the MIND diet, it stands for Mediterranean Dash Diet Intervention, which is just a mix of the two, and it's specifically designed to protect the brain, and it focuses on leafy greens, berries, nuts, olive oil, and fish. How these diets help are they are high in antioxidants to reduce cellular damage in the brain, anti-inflammatory properties to reduce swelling in the brain. Healthy fats support brain cell structure, and they help reduce amyloid plaque buildup, which is found in the brain and is linked to dementia. The different diets impacting hearing loss. So we have survival curves for 3 diets. It's the Mediterranean, MIND, and DASH diets, and in all 3 you can see that people who adhered highly to the diet, which is the green line, maintain normal hearing for longer, and the middle and low adherence groups decline more quickly, showing a higher rate of hearing impairment. The Mediterranean diet, which is the upper left corner, is associated with about a 20% lower risk of hearing loss. The MIND diet shows a 21% reduction, and the DASH diet shows the strongest, which is 28%. The Western diet showed a 10% increase, and this diet is pretty much the opposite of the other 3. It's prepackaged foods, red meats, high sugar beverages, high fat dairy, and high fructose. For the longitudinal study, it was 4 waves over the span of 2014 to 2020. Over 6,100 participants for the Mediterranean DASH diets, and a little over 5,100 participants for the MIND diet. The analysis also controlled for important factors like age, gender, education, BMI, exercise, health status, and calorie intake. So these results reflect diet patterns independent of those variables. And looking at the graphs on the left, there are cognitive scores over about 10 years for the MIND diet, and people with high adherence, which is the dashed line, maintain the highest cognitive scores over time, and the low adherence group declines the fastest. So you can see that people eating more in line with the MIND diet start out with better cognition, but the rate of decline isn't significantly different, meaning the MIND diet affects baseline cognition more than the slope of the decline. And then on the right is the DASH diet and the Mediterranean diet, and the pattern is clearer, with the highest adherence groups being the blue lines experiencing lower cognitive decline over the 10-year period, and the lowest adherence group consistently declining the fastest. The DASH diet in particular shows the strongest effect with the widest gap between high and low adherence over time. So overall, the takeaway would be that the Mediterranean and DASH diets are associated with a slower cognitive decline, with the DASH diet being the strongest. And then the MIND diet predicts a better cognitive performance at baseline, not really the decline. And because there is no cure, you have to take precaution, and practical tips for that would be adding a few berries a few times per week, eating leafy greens daily, choosing whole grains over white bread or pasta, incorporating fish, and snacking on nuts. Some alternatives you could do would be, instead of butter, you'd have olive oil; instead of fried food, grilled or baked; instead of red meat, you could have fish and beans; and instead of soda, you could have water or tea. And to conclude, strong scientific evidence shows that dietary patterns influence brain aging and dementia risks. The Mediterranean Mind and DASH diets are consistently linked to better cognitive function, and because there is no cure, taking preventative measures is all we really can do. And learning about this topic gives me hope that future generations, including my family, can reduce their risk of dementia.